Well, this is one of the most popular stories that we've run on this show. Lots of emails asking for more information. So by popular demand, imagine losing an inch of belly fat during your lunch hour without dieting or going to the gym. NBC's Tom Aspel on The Money Tonight from Tel Aviv. With us tonight, got Bob Gerberich, president of UltraShape North America, and Dr. Stephen Teitelbaum, plastic surgeon, who has conducted clinical trials with UltraShape's device. Doctor, I'm going to start with you. We have some sense in the report there as to how this works, but walk us through the science of it. What is it doing? Are there any potential risks? What are you looking for in the clinical trials, doctor?
The most important thing that people realize is this still has not even been processed through the FDA. So we're probably a year away from this being available in the United States. So viewers should treat this as science fiction. When it's finally available, they'll find out about it. In terms of how it works, a patient simply lies down. This transducer that gives the ultrasound energy is put on the outside, and it permanently destroys fat cells. We did a very intensive clinical trial measuring every conceivable blood test and liver test. There was no pain and there was no side effects, and everybody enjoyed some small amount of permanent fat removal.
How does it destroy those cells?
What it does is, if you think about a diagnostic ultrasound like a woman might get when she's pregnant, there's a transducer that shoots parallel beams of ultrasonic energy. What they did is they made a dome transducer so the beams all converge at a single point. And at that point, there's a lot of energy, and that's enough to burst those fat cells beneath the skin surface.
And then it just gets flushed out of the system once it's broken? Is that what happens?
Exactly. It gets flushed out of the system. But the important thing to remember is viewers should not confuse this with losing weight or even with liposuction. Some of the people you showed in the B-roll at the beginning show quite overweight people. This is not for that kind of person. This will never replace weight loss. This is for removing small areas of disharmony, incongruity, for instance, a little bulge on the outer thigh, a bulge in the love handles, but it's not going to substitute for weight loss. It should not be oversold. It is for body contouring at a small level. Ultrasound has been used for a lot of things in the human body. It started for doing cataract surgery, and it's used for hundreds of different purposes already in the body. So this is just one more use of ultrasound in the human body.
All right. Great to have both of you with us. Thank you, gentlemen.